Hello everyone, I'm Richard Conway, reporting for Room Now from EULAR 2022, which is in Copenhagen. I'm attending the meeting virtually, so I'm coming at you from Dublin, Ireland today. And I'm here to talk to you about an oral presentation. It was OP0025 by Rahman et al. And this was presented in the clinical aspects of psoriatic arthritis session on Wednesday. The title of this abstract was Factors Associated with Fatigue and Its Improvement, a Principal Component Analysis of Patients with Active Psoriatic Arthritis from the guselkumab phase 3 trials. So this study took to discover 1 and 2 studies of guselkumab in PSA. Those studies showed that guselkumab was an effective drug in psoriatic arthritis, both in biologic naive and experienced patients. And overall, there was over 1,100 patients between these 2 studies. So they looked at fatigue using the FACIT fatigue score. And then they did this principal components analysis of this to identify baseline factors which appear to contribute to fatigue. And they also did multivariable linear regression. And that was to look at covariates which are associated with change in fatigue over the studies. And what they found from the principal components analysis was that 62% of the fatigue in psoriatic arthritis appeared to be explained by identifiable baseline factors. And that was broken down. So 33.8% was explained by systemic disease and function. That includes things like the HAC, the patient global assessment, the physician global assessment. So a lot of the commonly used measures that we employ. Then 15.7% was explained by joint disease. That was tender joint count, swollen joint count. And 12% was explained by the skin as measured by PASI. This left us with 38.5% of the contributors to fatigue, which are unexplained by our current measures, even things like the patient global assessment and the HAC. When they went on and did their multivariable analysis, they found that improvements in CRP, improvements in function, improvements in the patient global assessment, and improvements in PASI were all associated with improvements, which makes in fatigue, which makes sense when you look at the factors that are contributing from the baseline factors. I think this is really interesting overall as a study. Fatigue is a huge problem for our patients. It is one of the most difficult things to manage and one of the things we get asked most about. It often doesn't improve fully with our currently available treatments, and it's a huge challenge, an area that's in need of research. I think these studies identify just why that is the case, with this very large proportion, over a third of the contributors to fatigue being unexplained by what we measure at the moment. So more research is needed, better measures perhaps are needed. For more from the EULAR 2022 conference, please tune in to Room Now across our various platforms and follow me on Twitter at Richard P.A. Conway.